All right. Welcome to Clear Vision Wednesday. I am Claudia Mühlenweg. I am the creator of the Natural Clear Vision Method and founder of the Natural Clear Vision Institute. And this is my weekly live show about all things vision and eyesight, and specifically how you can improve your eyesight and your vision naturally. So make sure that you are following this channel, that you're subscribing, and feel free to comment. We go live every week, and that's a great opportunity when you're watching live because I have an amazing guest today, and we can answer your question live right away. So you don't have to wait later to get a response to your question. And our topic today is an interesting one that I really honestly wasn't even that aware of. So when I met my guest, Dr. Meg Miller, I'm going to bring her on in a second, recently, and we talked about, vision. She said, histamine is a big topic. I'm like, histamine? So welcome, Dr. Meg Mill.
Hello, thank you for having me.
Yeah, so we were meeting, and you said, histamine is a huge topic with vision, and it has very big effects, in fact, shocking things that it can happen to your eyesight. So first of all, tell us a little bit about yourself. You're a functional medicine practitioner, but how did you get into working about with histamine? Like, how did that happen?
Yeah, so I have a virtual functional medicine practice where I see people all over the world, but I didn't start that way. So I got a doctorate in pharmacy, and then I did a residency in pharmacology, and went on to be a clinical pharmacist. And I was working, and I was seeing people with, we were just putting more and more people on medications all the time.
Mm.
And so I knew there needed to be a change. It's like, I need people to heal naturally. What else can we do? This isn't the solution. But at the same time, I was having a lot of health issues myself. And I had allergies from a young age. I was having anxiety. I was having GI issues, all of these things that weren't explained. And I couldn't find the connection. So I'm like, there has to be something going on. So I started doing research. And in that research, I realized, okay, everything's connected to each other. And one of the things that was going on with me is histamine intolerance, which we can get into and why it happens. But what we start to see is you have histamine receptors in almost every cell of your body. So we're getting these multi-system symptoms. So you can have maybe migraines, you can have anxiety, you can have difficulty sleeping, fatigue, GI issues, rashes, all these different things. You may have some of them, you may not, but it's more than just allergies. I think we all think of histamine, allergies, but
Right.
we really see it as a whole body issue. And so once I started to see, okay, I'm putting some of these connections together, my symptoms started to heal in so many different ways. And so I really felt like, okay, I really went back and got educated and certified in functional medicine. I opened my virtual practice. We work with all sorts of different things, but I did a summit last year on histamine intolerance because I just see this being such an issue for so many people, and we don't really understand why and what's going on. And it's really not well understood even or helped in the conventional space.
Well, yeah, thank you so much about that. And I researched a little bit. I told you before we went live, that once in a while I had like skin, like itchy skin and rashes, and it's kind of very irregular. So I've never really had it enough to the point where like putting like what is it related to? What am I doing when I do get these very rare rashes or itching? And my clients tell me a lot about itchy eyes, and I never had any allergies. I never had any of those, hey, none of these things. So let's maybe we start at the beginning. Like, what is histamine actually, right? We throw those terms around, but what is it actually, and how does it affect us, and how does it affect our vision specifically?
Yeah. So we'll start with histamine, its general
Right.
purpose, and then we can move into specifically vision. So histamine is what we call a biogenic amine. So when your immune system detects an allergen or an invader, histamine is actually released primarily from our mast cells and our basophils, which are part of our innate immune system, as a part of our immune response. So its job is to increase the permeability of blood vessels to allow other immune cells to actually reach the area more quickly. So it helps us in things like immune defense. It helps protect against pathogens. It helps actually regulate your stomach acid to increase food breakdown and digestion. It actually can act as a neurotransmitter. So it can affect serotonin, norepinephrine, acetylcholine. So it can actually we'll talk more about this in eyesight and actually regulating our circadian circadian rhythm. So our sleep wakefulness. It also affects cognitive function, brain function, mood, allergic responses, and actually is part of our inflammatory process. So it actually creates inflammation purposefully. So inflammation is important in acute situations because we actually need inflammation when we have an injury or when we have a pathogen coming in. We need that blood vessel dilation, that increased vascular permeability, but we want that to be temporary and stop. And I think when a lot of times people just get in this chronic inflammatory state where they have problems all the time. So one of the things that is, surprising about histamine, like we said, it can have symptoms all over your body because there are actually 4 different types of histamine receptors. So when we think of an H1 receptor, histamine 1, that's when we think about mostly like our allergy type symptoms. But we have, like I said, 4 different ones and they have different purposes. So when we are looking, let's go specifically a little bit into eyesight now. So we have H1 receptors, and they are usually found in the conjunctiva or other ocular tissues. So those are more, like I said, responsible for like the itching, the redness, the swelling. So when you get like allergic conjunctivitis, it can lead to like the itchy, watery red eyes. We have H2 receptors, and those are present in your eye's blood vessels and tissues. So they have more of a role of regulating blood flow within the eye. So that can affect your vasodilation, like the expansion of your blood cells, and that can also contribute to redness and possibly
Like the
affecting
red
your
eyes, even the Halloween red eyes, right? Is that,
vision.
yeah, uh-huh.
Yep. So we're seeing that we have H3 receptors, and those are found in a lot of those are found in our nervous system, but they can also affect like our ocular nerve pathways. So they can regulate like neural signals and inflammatory responses. So that's another thing that we can see. The H4 are found mostly in our like immune cells, like mast cells and eosinophils, but we can also have that seen in like recruitment of immune cells, and that can actually lead to ocular inflammation and irritation. So, because we have these cells, these receptors in the cells, we're seeing this as a full body issue in all of our cells, but particularly in our eye cells, and we don't always think, it's just funny because you're not always thinking of histamine when you're thinking, maybe if you have the allergies, it's the spring or the fall when people's
Right.
allergies get bad and you have itchy eyes and you're like, oh, I have allergies. But this could be like affecting you in other ways that you're not even noticing. One of the interesting things is even with like, I think you and I were talking about ocular migraine. So migraines can be caused by histamine. So that's another like symptom that we see. So even the visual disturbances with a migraine can come, when we're looking at it, can come back to an increase in histamine.
That is so fascinating. I mean, first of all, we have 4 different receptors. I mean, when you describe them, it reminded me of somebody holding the door open, right? So that the other things can flow through easier, right? So that was kind of a visual that popped into my head to remember this. But so you talked about different parts of the eyes, right? The H1 seemed to be the one that's more the conjunctiva, like basically the outside, the watery, the itchiness, the redness, all that, and then the vasodilation and the nerves that can obviously be related to eye diseases. Like, I mean, glaucoma is usually eye disease based on there's some nerve, there's either too much intraocular pressure in the eyes or there's not enough nourishment of the nerves. So there can be a breakdown. Is there anything related to histamine that affects that? For instance, glaucoma is called the silent vision killer, right? Because you don't really notice that you lose your vision. You lose most of your peripheral vision, and it's a huge problem. So is there a relationship to histamine with glaucoma, for instance?
Yeah, so actually dysregulation of histamine can affect like in several ways. So actually histamine follows a circadian rhythm. So it actually helps regulate our interocular pressure. So disruption in this regulation can lead to interocular pressure like we were talking about and increase the risks of glaucoma. So it
Wow.
also histamine can also dysregulate like lead to that change in vascular tone in the eye. So impaired vascular function can also be a way that it actually leads to glaucoma too. So, we're looking at it and, you're not thinking about that necessarily,
Right.
glaucoma and histamine, but there we see that connection there too. So I think there's more, when I was coming on here, I was doing some research because I was looking into, some studies, and there's more, it seems like there's more and more studies on this correlation, and really even trying to look at treatments of glaucoma from the histamine receptor perspective.
That is so interesting. I've never heard an eye doctor, and it's not like I that much, but
Yeah.
ever talk about histamine. And it's
Hmm.
such an important, I mean, that's just crazy because glaucoma, there is really nothing other than eye drops they prescribe you to lower the intraocular pressure. So that is really fascinating. But you said, so histamine is regulated by the circadian rhythm. Now, I'm a big proponent of getting natural light. I had many episodes here, and I'm sure you do something similar, but we can talk about it. Getting your natural light into the eyes, right? But sunrise, living by the circadian rhythm, not exposing yourself to junk light or blue light in the evenings, to help with your circadian rhythm, your sleep, and all of those cycles. So is it, to me, it's so fascinating because we get most information into the brain about, the light time of the day, the retinal cells, and there's special cells in the retina that you probably don't know about, but I think they're retinal ganglion cells, but even blind people have those. So even blind people know what time of the day it is, even if they have no sight. So isn't that, I mean, to me, I'm always
It's
so amazed
fascinating.
how
Hmm.
amazing our biology is. And then we're putting on sunglasses, we're spending all day indoors, right?
Hmm.
Uh, anyway, this is,
So that's an interesting thing. So do you recommend not wearing sunglasses?
yeah. I mean, here, definitely, that's a big piece of what I do. However, I mean, I always give disclaimers. First of all,
Hmm.
if your pupils, right, which is what I call the built-in sunglasses, right? They open up in darkness, they constrict in brightness. If there's any impairment in your pupillary reaction, or if you take any drugs, right, that, if you get atropine at the eye exam and your pupils are white, big and
Yes.
white, 100% need sunglasses. There's also extreme bright condition like skiing. I mean, I'm talking about our regular daily life. I'm not talking about being on the ocean or in, snow,
Hmm.
or those things. Yeah, because I mean, that we don't want to get derailed from this conversation, but the eyes are light receiver, and the brain actually determines even melanin production in the skin based on how bright it is. And if we have these dark sunglasses on, the brain thinks, oh, it's not that bright. I don't need to secrete so much melanin. They actually found that there's a higher risk of sunburn because, again, your brain doesn't protect your skin.
Process that. Hmm.
Anyway,
Yeah,
let's
and
get,
it's I know it's all it's so interesting. That's fascinating how it's all connected. Do you want me to talk a little bit about why we get imbalances of histamine?
yes, yes, exactly. So I think I'm really interested in, um, like we talked about, maybe first before we do that, like some more
Okay.
symptoms, like because
Yeah.
who thought like headaches, regular headaches,
Hmm.
ocular migraines, like what are other
Hmm.
symptoms? And I think
Yeah.
this is just don't like because so many of the things you talked about, anxiety, and you like, it's like literally could be 1,000 different root causes, right? But what are other things that might point to a histamine dysregulation or intolerance? And what's the difference between dysregulation and intolerance?
Yes. So it's a full body symptom. So we think of nasal congestion, like sneezing. We think of asthma, difficulty breathing. You can think of rashes or hives, and those can all be histamine symptoms. But we also see headaches and migraines, fatigue, heart palpitations, dizziness, anxiety, difficulty concentrating,
Wow.
PMS, irregular periods. I know it's like flushing, joint pain, sleep disturbances, high and low blood pressure. We were talking, about some of those eye symptoms. So it's just really like all of those put together, you're not necessarily thinking of histamine. And that's where it's tricky because I work with people where their biggest symptom is anxiety. So
Mm,
when they have histamine reactions or anxiety goes up, unless you're educated and understand that connection, you really won't even notice that that would never even be something like most people are going to talk to you could be the reason behind your anxiety. So it really is interesting how it plays out differently for everyone, but all of those things, and especially if you have more than one symptom, you start to think, okay, could there be this connection? What sometimes when we pull that thread, we start treating it that way, then a lot of different symptoms start to clear up because we're getting to that root cause of why you're having the symptoms.
Well, let me ask this. I know several people that have anxiety challenges. So how do you test? Like my first question would be like, well, how do you know that you have, and
Mhm.
also what's the difference between intolerance? It seems like kind of strange to, like, I always talk about light, right? Eyes are light receivers, and now you're saying you're so light sensitive, you're light intolerant, but what does that mean with histamine? If this is a crucial part of our health, how can we be intolerant? And what is dysregulation? Or is that the same thing?
Yeah, so basically they call like the histamine dysregulation like histamine intolerance. So
Okay.
when you it would be the same thing. So
Okay.
so I like to use a bathtub analogy when I explain this because I think it's just the easiest visual to see. So, if you have a bathtub and you're filling it up and you have the drain open at the same time, everything's in balance. The water's just draining out. So we have two problems here. Either someone plugs the bathtub up or the water's pouring in too fast, or both. And we start to get this overflow. So you start to get histamine intolerance when you're getting too much histamine in your body. So, like we said, it has a purpose sometimes, but when we have too much, we start to have all these symptoms. So, first we look at what clogs it. So, we need to break down histamine in two different ways in our body. We break it down through diamine oxidase in the gut. So, you need to have good digestive health. And then we also break it down through methylation. So a pathway called histamine N-methyltransferase is what breaks down the histamine in the other pathway. So we need to have open pathways to break down histamine. So the first thing is if we're not methylating well, or if we have dysbiosis in our gut, we have compromised enzymes, we can get into why that happens. It happens for a lot of reasons. We can't break down the histamine. So then we look at, okay, what's filling the tub? So are you eating a lot of high histamine foods? Those can be healthy foods like avocado, fermented foods, bone broth, things that we're not,
Oh, really? Oh, tell
strawberries.
us more. What are high histamine foods? Okay, this is
Yeah.
fascinating.
Yeah, so I mean, that's what gets tricky because a lot of people are eating them because they're healthy food. So we have fermented foods. So, things yeah, kimchi, kombucha, like all the things that
Sauerkraut,
you're eating,
German.
sauerkraut that you're trying to eat to feed your microbiome, bone broth. We have avocados, we have tomatoes and strawberries and bananas. I mean, there's a lot of histamine, and I can even link if you want to share. I have a guide, Essential Guide to Histamine Intolerance, and it's very detailed of like what foods are high in
Oh, yeah,
histamine.
that would be
So
amazing.
we can do that for you too,
You
so
can
that
put that in
they
the
can
show notes. Yeah, yeah, for
mhm,
sure.
that we
Hmm.
can link. So, but yeah. So we're looking at, like we said, healthy and alcohol, tea. These
Tea,
things
which
are going
tea? Wait,
to
which tea? Which tea?
black tea. So black
Oh,
tea can impair
that's,
diamine oxidase.
oh,
hmm So,
everything you listed I have except for bone broth because I'm plant-based, but everything you
uh,
just said, I have,
I,
like, I mean, I don't have big problems, but I'm now
mhm.
curious to find out if I can make it better. Okay, keep going.
hmm Yes, so I know, and that's what it comes down to because a lot of people are eating healthy diets and we're adding these foods in. And for most people, for you, it's probably fine because you're able to break it down. You're not having an issue. But it's when we have these issues, like, okay, so you're eating those foods, and then maybe you have an underlying gut infection. Maybe you have a parasite or candida or something else that's activating your immune system, and then maybe you have some allergies, and then maybe you have some toxic exposure, or maybe you get a virus, or maybe you have something. These keep piling. Maybe you have high estrogen compared to progesterone. Hormones can actually trigger mast cells to release histamine. So we start to get these things that pile up, pile up, pile up, and then we're getting too much where we either can't break it down fast enough, or we're just, it's just this overload. So we have to balance. We have to make sure that we heal your gut, that we actually can optimize diamine oxidase and methylation. And then we have to see, okay, what are all the things that are actually creating this overload, and bring that load down. The tricky part is that when you're hearing about gut health, a lot of the things that people normally do to heal the gut actually can trigger histamine
Fermented
intolerance.
foods.
Fermented foods, certain probiotics, like so bone broth, like all those things that people are saying, do this. Well, if you have histamine intolerance, that's actually going to backfire for you. So we have to do it a little bit differently.
Wow. Okay. So now let's find out, because you talked about mast cells, right? I'm curious, how, first of all, how do we find out, how we test this? And do we see H1, H2, H3, H4? Because if I remembered correctly, because this was a lot of new information for me, the H4 is the one released by the mast cells, like so, and some of them are more eye-based. So how do we know exactly what our issue is? How do we test this?
Yeah, and this is hard to test. So there's not an easy way to necessarily test. So even if you get a blood test for histamine, a lot of times we'll see histamine levels come back normal in blood tests when people have symptoms.
Mm,
So we're really doing more symptom analysis with the histamine intolerance than we do have like diagnosable tests.
I see.
With mast cell, there are certain diagnostic criteria, although you really, so we're looking at like urine trip, we are looking again at histamine levels, we're looking at tryptase levels because mast cells release more than just histamine. They'll release tryptase, they'll release heparin, they'll release cytokines, all of these things. So we can see certain criteria. There is diagnostic criteria for mast cell activation. But you may also get a false positive, I mean a false negative if you're not in a flare. So sometimes you have to be in an active flare in order to actually see it. So we have a lot of people that get diagnosed, like said, okay, you don't have this, but they still have all the symptoms. And
Mm,
really in my case, I don't need like a clear diagnosis. I mean, if you're having symptoms, we need to figure out what's going on. So people can get very hung up on like, do I have it? Do I not? What's my diagnosis? And it's like, well, we need to do the things that we need to do to make you feel better anyway. And so we don't necessarily have to have that, but it really wasn't even a diagnosis. I mean, it really was mast cell activation syndrome wasn't even a diagnosis until 2016. So there's just so much new information coming up all the time. But it's a little bit different. So they have very similar symptoms. Mast cells, what happens is when you get all of these things. So, when you're getting a load of like, let's say you have a parasite and maybe you have some candida and you maybe have some heavy metal exposure, you got a tick bite at some point, you might have mold exposure. I mean, you don't have to have all of these, but these are things that are starting to make your immune system like, okay, I'm handling this. Okay, now I'm handling this. Okay, I can't, and your immune system starts to
and
not
COVID,
be able.
carrying the.
COVID, I mean, it really went up after COVID because then people got COVID, they couldn't handle now the virus on top of their other burdens, and then your mast cells actually just get hypersensitive. They get almost like angry, let's say, and they just start releasing to everything. So they start degranulating. Maybe if you're eating chicken or if you're eating, if you're drinking water or you smell something or they're inappropriately releasing, and that's where people start to get reactions to all of these things. So you become really like what we more say generally hypersensitive when you have mast cell activation syndrome, and that can be one of the reasons that you get the histamine issues because your mast cells are constantly releasing histamine. But you don't have to, they are separate. Like you can still have histamine intolerance without having mast cell activation
Hmm,
syndrome. You can actually have mast cell activation syndrome without having histamine symptoms, but it's not that common because
I
your
see.
mast cells are releasing histamine. So most often you're going to have histamine symptoms.
So it sounds like it's a little bit of detective work, right? You
It is.
experience having worked with this for many years. I'm really curious because all the foods that you listed, right? I didn't like, there was like nightshades and there was animal products and like fruits and vegetables. I couldn't really find a common denominator amongst those. You said black tea, but you didn't say coffee. You said alcohol. So my question is, what about, the one thing, and we are in a group together, in a huge group about holistic practitioners. We always talk about dairy and gluten, right? As a like number one thing, if you have allergies or gut issues or whatever, is that something that I'm just curious? This is more like a personal question. Is that something that you find connected to histamine, or is that not so much the case?
It so them that like themselves aren't necessarily all high histamine, but it is because so okay, like if let's say you're going to look at cheese, we're looking more like the aged cheeses would have more histamine
Ah,
than like a fresh cheese. However, we do want to look at those because gluten and dairy can be inflammatory for a lot of people. So when we're looking at, this is a really good question. So when you have food reactions, you can have three basically different categories of food reactions. So you're having an allergic reaction. So an allergic, like a true allergy, is an IgE antibody. Well, actually, we have kind of four because there's an IgA, but for the basics, we have an IgE antibody is an allergic reaction. So basically if you have an allergy to a
like
food
a
generally.
peanut butter, a
Peanut
peanut,
allergy.
like most people are shellfish or
Yes.
gluten, really crazy symptoms, you have to go to the ER and
The
stuff.
ER. Yep. And that's like, okay, that food, you always avoid it. That's one. So then we have the IgG antibody reaction, and that's where we have the food sensitivities. So that's where we see a lot. Those are the two most common IgG reactions. So those IgG antibodies are going to stimulate your immune system because you're creating these antibodies, which is making your immune system react. When we're talking about the histamine breakdown, we're actually talking about an enzymatic reaction. Because diamine oxidase is an enzyme that breaks it down. So we have, these foods are high in histamine and we can't break them down well because we might not have enough diamine oxidase or we have too many. And so we get the imbalance. So I know like I'm roundabout answering it, but it's like not 100% clear because it's like, okay, even if we have that fresh cheese, let's say, and it's not high in histamine, it still could be giving you a food sensitivity, which could be activating your immune system, which in this case, we really need to calm everything down. So it could still be a problem for you.
So I know we're getting a little bit off track with eyesight, but since you
Yeah.
said about, talked a lot about eyesight, but I remember some family members that this was like literally 20 years ago. Like I have so many allergies, and one was my ex-husband, and he came back, and they put these little patches on your back. I
Oh,
haven't been
mhm.
there. They put these little things, and whatever gets red or there's a reaction. He came back and he said, "I'm allergic to grass and dust." I'm like, I know that you never mow the lawn and you never clean.
You're just naturally avoiding your allergies.
Anyway,
Yes.
I'm like, what, like, so, can you talk about maybe they still do those tests? I don't know, but I know that was kind of a
Mhm.
popular thing
They
where they
do.
put, so is that something that people still do, or is that useful or?
So that would be that when you're doing that, you're doing those are the IgE allergies. So those are like foods that your body, so we have two different types of immune systems. We have the innate immune system. That's basically saying like, do we have a threat? Like it's
Mhm.
surveying all the time. Do we have a threat? And that's where your mast cells are a part of that. So they're saying, okay, what do I need to attack? Now, then we have the adaptive immune system. So then like that's the second step. And the adaptive immune system tags specific things. So it's saying that dust or that grass, those are specific, like we have an allergy to you. So basically, like in your body, those IgE antibodies have tagged certain things. So for
Like
your
pollen,
husband,
right?
your
Pollen,
ex-husband, yeah, and
pollen.
pollen, those kind of things. So when we do that testing, we're seeing, okay, what allergies do you have? And then a lot of times then you do sensitization therapy for those specific allergies. So that's when you do like an allergy shot, or they have drops or different things that you sensitize your body over time so that you can tolerate it.
Got it. Well, I'm curious, like this sounds all like, wow, you really need to be Sherlock Holmes or have hire
I
Dr.
know.
Figure out like what is the actual issue here with
Mhm.
an imaginary magnifying glass.
Yeah,
Um,
I say we're detectives. I always say when I'm working with people, I'm like, you're detectives of you.
right. So what
Mhm.
like what are some easy things that people can do? So everybody listening or watching this, like what are some first easy steps? Obviously I help with vision and maybe your tips are not directly related to vision, but what are some things to figure out what the heck is going on and what they can do to, address this histamine intolerance?
So I think, if you are someone who like is like maybe suffering with these symptoms or even that allergic conjunctivitis all the time, you have eye symptoms, you're like, okay, could this be histamine related? One thing you can do is just start to see if a low histamine diet makes any difference. I
Mhm.
don't like people to get hooked on a low histamine diet long term because there's a lot of, like we said, good nutrients in those foods, but it can be a great investigation tool to start and see, like, okay, if I'm just bringing down my histamine load for 3, 4 weeks, do my symptoms clear up a little bit? And then that can be a signal to, okay, maybe histamine is part of what's going on with my symptoms. So I think that that's like a place that I would start as an investigation. If you just are like, okay, could this be an issue? It's not 100% like black or white, because we really in the end need to find out, like you said, investigate what's actually going on and what's causing it. But I think that's a great first step for listeners, just to say, okay, follow low histamine diet, see, do you notice any difference in symptoms? And that could start to lead you to, okay, if I'm seeing a change, maybe they didn't totally clear up, but there's a difference, then what do I need to do next in order to get this figured out?
And that's the guide, right?
Mhm.
The guide that you gave me, I put that in the Zoom chat right now in our membership here on Zoom, and I'm gonna put it on YouTube. It's also gonna be underneath your video in the show
Mhm.
notes. So first of all, you said 3 to 4 weeks, because I know with gluten, for instance, they always say you have to be like 3 months.
Mhm.
So, like if you do it for a month, which I think is a doable time, you get the list,
Yes.
you
Mhm.
avoid all these foods, you find alternatives, do it for 3 to 4 weeks, and you see, okay, am I feeling better? That's a great way to get started. Is there anything else people can do without hiring the detective, Dr. Meg?
Yeah. Well, yeah, and I mean, also getting things that are common, like quercetin is a nice supplement. If you're looking to do it more naturally, quercetin's a nice supplement to start. I actually have supplements on my website.
Oh,
So
okay.
I have a website called megavitalityshop.com. And so there's two supplements that really help a lot of people. So one is called Hista Relief and one is called Hista Digest. So the Hista Relief is bringing down the histamine levels, and then the histodigest is a diamine oxidase enzyme that you can take with your meal. So if you're struggling to change your diet, then you can take a histodigest so you can actually help your body break down the diamine oxidase. So that's another
Got
thing.
it.
I forgot one important point with the diet
Okay,
too.
good. Please bring it on.
Yes. The other really important point is preparation. So even if food is not high histamine, if you cook it, it can grow histamine. So let's say like
Oh,
chicken isn't generally a histamine food, but you have to be really careful of leftovers because food can grow histamine. So a lot of times when we meal prep, we flash freeze until you're ready to eat it because we don't want it to actually grow histamine. So I think eating out can be challenging. So sometimes, like if people are going to eat out, we just have them take the diamine oxidase enzyme to help them break down the food if they don't know how it was prepared.
wow. I mean, I'm just downloading your guide. There's so much, guys. This is amazing. This is very detailed. It's not one of those things that you download and there's one page with like 3 words on it. It's like literally amazing. So,
Okay.
like, see, mom, I told you those leftovers are not good.
I know. Yeah, I don't have to eat them. I said that to my husband because he's like, "Oh, we'll keep them." Like, well, I can't eat them after 24 hours. So if you're going to eat them, you keep them, but I won't be. That's after that point.
I'm a big
Yes.
left. Anyway, so there's a question here on Zoom that I
Okay.
want to answer. Like, how does cooking chicken grow histamine or increase histamine? Can you explain that a little bit?
So once meat, so histamine will grow in things. So it's like you also have to be careful with, like, let's say fish or beef or chicken, like in when it was killed and when you cook it. So think of like a fish, you want to get fish that was flash frozen. So it wasn't like sitting out for a long time for histamine to grow. Once you cook it, it can grow faster. So that's like once it's cooked, you want to again freeze it. Freezing will slow it down. So it can, so think of like I mean, histamine isn't bacteria, but like even think like, I'm just going to give you the example because it's easier to visualize. You know how like we can have it sit there and bacteria can grow. Histamine can also grow in foods.
Oh, wow. Okay, that's fascinating. Basically on YouTube, I hear fantastic information. Thank you from Canada and from Australia. There's a question on Zoom, I think that could also be helpful. FODMAP, right?
Mhm.
FODMAP is a diet that was recommended to me at some point. FODMAP, it's like that's I think what was it for gut health? I can't even
It's for
remember.
SIBO.
So is that helpful, or is that like you basically saying stick to the antihistamine foods that you have in your guide?
So it depends. So FODMAP foods are for small intestinal bacterial overgrowth.
Ah,
Now that sometimes people, so when we're getting into the detective piece,
yeah.
that's on SIBO, small intestinal bacterial overgrowth, can be a reason that you get histamine intolerance because there are certain, think of the immune system activation, but there are also certain bacteria that are actually histamine producing or mast cell releasing bacteria. So,
Mm.
that's when we get in the question, do you control your body or do your microbes? Because it could be beyond how you're digesting. It could actually be you have specific microbes that are producing histamine. So we also need to rebalance the microbiome, work on the bacterial overgrowth, and to actually fix the problem. So if you're feeling, so I would say FODMAP foods won't like fix histamine intolerance. If you're doing well on FODMAP foods because of your bacterial overgrowth, then you can stay on the FODMAP foods and look at the histamine foods in addition. But we ultimately, in that case, need to look at the bacteria and what's actually causing the symptoms.
Wow. I mean, at the end of the day, everything starts with the gut, right? We know that. And I have some my ophthalmologist friend, Dr. Radka Toms, she is like focusing on nutritional ophthalmology now, but she had just gave a talk about the gut, brain eye axis, right? For fellow colleagues. So I think we understand more and more that the gut microbiome is really so important, right? And it's like it's a whole. I'm excited. I don't know about you, Meg, but I'm excited about this new world where we really start to understand things better. At the same time, it can be really overwhelming because who
Mhm.
doesn't like those lists? Don't
Yeah,
eat that, eat
I
that.
know.
I never put those things because, like you, I feel like it's very individualized, and
Mhm.
it drives. I'm vegan, but I can't stand the food religions when people are just like, you should only eat this or you should only eat this, because at the end of the day, we just learned from you how important it is to like connect with your like figure out what is the root cause and what is the thing that so that might be really good for you, and what is the sauerkraut that everybody tells you to eat is probably the worst thing that you should be eating, right? So really interesting. I don't see any new. Let me see if there's any new questions. I think we answered all the questions. Let me look on YouTube one last time. But we want to hear, how can people work with you? I do want to know that too.
Yes, yeah, you can find me. My website is megmill.com. So it's just megmill.com. I have a podcast called A Little Bit Healthier. So come over there. I'm giving health tips all the time. I'm over on Instagram at Dr. Meg Mill, which is just DrMegmill. I'm starting YouTube. I'm not have not been great about I need to get everything over here because I love YouTube. I just haven't haven't done it yet. But look, search for me. I'll be here soon and be bringing more information. But yeah, you can always find things. I put a lot of stuff out on my website too. So, and I have a lot of free guides and everything to give you information.
Yeah, and your
Want to
guide is really,
teach?
really great. Sorry, your
Mhm.
guide is very detailed. I absolutely love it because it's like very, very thorough about the symptoms. So get that guide, you guys. I mean, that's just giving you so much information already. So sorry, what did you want to say?
Yeah, no, it's like I think I just am passionate about teaching it and sharing it because I think it is something that you're going to go into your doctor and you're not going to necessarily get this information. So when it can be just game changing for people once they start to put this piece into their thought of, oh, wait, okay, these symptoms could be something that I'm dealing with, and we can get to the bottom of it and really have so many symptoms clear up without much real, you just have to detect. It's just detective work.
Yeah. And I know you work with people one-on-one as well. I know that's very limited, but we
Mhm.
put all the links into the YouTube chat and in the show notes. So if you feel like, you are you doing a free
Yeah, I have a
consultation?
free consultation. So yeah, and I actually do them myself. I like to talk to each person before we work together to make sure that I can give you the best help. So I actually do meet with you, and so I have a free discovery call. So I'd love to connect with you if you think this could be something that you're dealing with.
Sounds amazing. Well, I don't know. Any last final words you want to say before we finish? Oh, wait, of course, the second. No, there's new questions. There's some people saying never considered this and have those reactions. So I don't see any new questions. So any final thing you want to say to the YouTube audience?
Yeah, I just always like to give like believe in yourself and that you can heal. I mean, I think we're at that place, like you're saying, there's so much more information out there. It can be confusing, it can be hard to navigate, but you know what you're feeling. Listen to yourself and know that you do have the ability to heal. I really do think it isn't just like, yeah, everybody needs to do this, everybody needs to do that. Look at yourself as an
Mhm.
individual. But, I see people make huge health transformations every day, and it's such a gift, I feel like, to be able to be in this space where we do get to see this. So I would just want you to know, no matter where you are in your journey, you do have the ability to feel your best.
Yeah, and I think I want to add, I love that. And I want to add to that, surround yourself with other people that are on the same journey. That's always,
Hmm.
with my work, like everybody laughs at you, like, haha, how is this even possible? And having other people, right, be on the same path and be as interested in that is so important for our mental health too and our emotional health,
Hmm.
so that we don't constantly get like, my mom used to say, I don't know what you eat anymore, like and it
Yeah,
we get to
it's a,
it could be, you're that weird person that brings that on Tupperware, but you know what?
hmm.
Like you are going to be the healthy, happy person that lives longer and doesn't have all these
Hmm.
chronic diseases and a whole box of pills they have to take. So, right? I think we all have
Yes.
like let that be okay. Let the freak flag flow and have
Yeah,
your,
I know.
whatever you do. So thank you
Hmm.
so much. That was incredible. We got amazing comments, and I learned so much from you, Dr. Meg. So thank you for being here with us today on YouTube. And if anybody is, please subscribe to her channel, subscribe to this channel. If you have any questions and you're watching this after the live show is over, we will do our best to answer your questions. So please comment, follow, subscribe to the channel, and like this amazing live episode that we did with Dr. Mill. Thank you so much.
Thank you.
And